But right now, as these guys, and they will dive headlong into the roulade, and probably we'll never see them again if truth is known. We've got some great advice from mums and dads, I know, out there. And it comes from a service that's open to all, the local pharmacy.
Today I'm back in Duleek to meet pharmacist Kathy Maher, who's going to talk children's health and the most common complaints in kids. So Kathy, first of all, fever and temperature in kids.
Yeah, very prevalent this time of year, maybe coughs, colds. Yeah, really have to watch out. You have to make sure that you treat the fever. So we'd say make sure you check the temperature. Don't just go on feeling the child's head. Make sure you check it. Normal temperature for a child would be 36 to 37 degrees. So if it goes up as far as 38 to 39, then I would recommend treat the fever at that stage. So there's paracetamol, and would be Parapy, Calpol, lots of brands of paracetamol and ibuprofen. So they're the two medicines used to treat fever in children. They're called antipyretics because they reduce the temperature. What's really important is that you give the correct dose for the correct age and weight of the child, and don't go on the, oh, he's a big 5, I'll give him the 6+ dose. That's really important that that doesn't happen. If the temperature has dropped by 1 degree within 20-30 minutes, we know it's beginning to work. If the temperature is still up at 39, 40 degrees, you've given the medicine, it's not working, at that stage we recommend contacting the doctor. Another thing parents often ask is, can I give ibuprofen or Nurofen or Phenapine and Calpol together? Do I have to leave time between them? So with paracetamol, it's very important that the dose isn't exceeded. It can be very dangerous, even in very small overdoses. They can be given at the same time, but as long as the excessive doses aren't reached. For very young babies, or if the temperature needs to be reduced very, very quickly, suppository form is very quick, very effective. If a medicine is administered in suppository form, so it goes in the back passage, it doesn't have to go into the tummy, it doesn't have to dissolve, it doesn't have to get into the bloodstream. It actually works very, very quickly.
Kathy, teething is a tough time for mother and baby. What would you recommend?
There are lots of ways of helping the pain of teething. You can either administer paracetamol or ibuprofen, or you can use a topical preparation, something like a mild anaesthetic. They can be used from 4 months upwards. They're absolutely fine. Other self-help things that we would recommend to parents, something cold to put on the gums can help alleviate the pain. Something like even a bit of frozen banana or frozen carrot. The baby can chew on that. So it's anything to relieve the distress and pain that they're in. They can teeth for months before the first tooth pops through, so we just have to make sure we manage that.
Yeah. Kathy, what about tummy bugs in kids?
Well, again, it happens an awful lot, again, any time of year, really. The main thing is to make sure the child doesn't get dehydrated. Young children, babies, get very dehydrated very, very quickly, so we'd make sure that parents use something like oral rehydration to replenish the fluids that they've lost, either through vomiting or through diarrhoea. We recommend that they start using those pretty quickly. One error that can happen is that they make them up maybe with the wrong amount of water, so we need to make sure that they use 200 mils or 7 ounces of boiled cooled water to make them up properly. To avoid dehydration, we would say even 10 mils every 10 minutes. Sometimes if a child drinks a lot of fluid very quickly, they'll get sick again, they'll just bounce back up. So we would say 10 mils every 10 minutes, and that's only 2 teaspoons really, so 10 mils is very easy to get into them. You can even freeze it and let them have ice cubes, whatever way, but the most important thing is to get fluid back into children. The signs of dehydration sometimes can be that their skin isn't as elastic as it should be. If they're very young, they may have very dark sunken eyes, or the little soft spot on top of their head might be soft as well. It might be sunken in the fontanelle. So again, you need to watch out for signs of dehydration.
Now, the unfortunate thing is, Phelim only made dessert for Catherine.
And